Placing a loved one in a nursing home can be an emotional experience even when we know it's best for them. On this week's edition of Today's Health, we learn that sometimes there can be problems despite the best of care. Benita Zahn set out to get answers about fall prevention.
A lot of the people come into the nursing homes because they've been falling at home.
Nancy Lavelle is the executive director for the Foundation of Quality Care for the New York State Health Facilities Association. She says upon intake, residents should be evaluated for the many factors affecting fall risk.
Could be their effort getting out of bed. It could be their gait is off a little bit.
Understanding the cause helps prevent falls. But if a resident has dementia, they may not be able to remember safety recommendations.
You'd have to be sitting with them one-on-one 24/7 to prevent a fall.
So the key is preventing injury. And that takes a little detective work on the part of staff. They have to figure out when a resident falls. Can routines be changed to prevent falls? It may be as simple as more supervised trips to the bathroom. What nursing homes won't do is put rails along the bed to keep residents in. Some will simply climb over, leading to injury.
They can get caught in the side rails. So if they're not physically functioning well, they're trying to get out, they could get their legs stuck, their head stuck. There's more deaths related to side rails than there are from falls.
Death from asphyxiation if their head gets stuck between the rails and the mattress.
There's low beds, actually, that people use low beds. When they use a low bed, person could still roll out of bed, so they actually get mats and put them next to the bed, so if they roll out, they don't get hurt.
And restraints are not an option. Lavelle says they're rarely used, and then only in specific medically recommended cases, such as a patient who's pulling out life-saving tubes, like the one through which they're breathing. If you have ongoing concerns about your loved one, Lavelle says talk with the unit manager.
If you don't get results at that level, then you should be sitting down with the administrator and the director of nursing at the facility.
In other health news this morning, promising research continues to mount for an immunotherapy called CAR-T to treat leukemia. The latest study shows tumors shrank or disappeared in about 70% of patients with the most common form of adult leukemia. CAR-T involves harvesting immune cells from patients, then reprogramming them to find and destroy tumor cells. The study involved 24 patients with a form of leukemia called CLL. They tried and failed all other available treatments. The attacks on the World Trade Center happened 16 years ago, but survivors still suffer health consequences. The New York City Health Department has been tracking nearly 9,000 people who were in the area that day. Those exposed to the massive dust cloud are at greater risk for developing asthma and other lung conditions. People who'd sustained broken bones, sprains, or head injuries were also more likely to develop heart conditions. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.